Hi folks, it's Dr. Walker from DentalWalker.com. Welcome back to the channel. I'm going to talk about a couple of things today that has been bothering me for the last couple of years now. Some of them I put on X just to kind of give you an idea in terms of what my thoughts are regarding them. And I talk about them, and the reason I do that is because a lot of folks will think or assume that these things are the more normal forms, or they're better for you, or that you've been told by your doctor that's actually better for you, or it's the only one available. And a lot of those things sometimes are just flat out wrong, right? And I tell you, I didn't know about these things until probably 5 years ago when I really started digging into some things and finding out that a lot of what I'm looking at that have been considered to be conventional medicine is really fraught with problems, right? And so I want to talk about like 5 or 6 of them today. And again, if you follow me on Twitter, you'll see on X, you will see that I do dabble a little bit into these things and tell you when I find out that these things are not good for you, I tell you about them, and hopefully that you'll see them and listen to them and sort of get away from those things. Before we get too far though into this video, if you like what we're talking about, give me a thumbs up, give me a like, hit that like button for me, and so I can continue doing what I'm doing. I like what I'm doing. I love what I'm doing. In fact, I love learning these things. Again, a little bit away from the conventional path. And when I do find them again, I will share them with you as best as I can. So one of the first things I talk about that a little while ago, I told you to go to your medicine cabinet and look to see if you're taking a supplement. If the supplement has on anywhere in that bottle, if it says folic acid, I told you to go ahead and get rid of it. Take it to the trash can, toss it, just get rid of it. There is a flaw in the assumption in a lot of us, in that we're assuming that people who are taking this, quote, folic acid, they have the ability to convert folic acid into the usable form, methylfolate or folate, right? Half of us, about 42% of us, thereabouts, are unable to convert folic acid into folate because there's a gene that's missing, MTHFR gene, a disorder, methylene tetrahydrofolate reductase gene disorder. If you have that gene disorder, you are not able to convert folic acid into the usable form of folate. That's a problem because you end up having lots of complications, to include diabetes and blood sugar issues and blood pressure issues and all of those things, all because of that one thing. Now you can actually go and test yourself to see if you have that gene disorder, MTHFR gene disorder, or you can just get rid of folic acid out of everything. So it's in a lot of things. You'll see it's in fortified foods, it's in your energy drinks, it's in cereal, it's in baby food, baby formulas, it's in a lot of things. Folic acid, and again, the assumption is that you can convert folic acid into the usable form of folate, and some of us simply just can't do that, right? We have that disorder, and about 42% of us, as I said before, have the disorder. So the easiest thing to do, in my opinion, is to just get rid of folic acid altogether and use the best form, folate. Now, they'll try to trick you sometimes by putting folic acid in parentheses, and then it says folate. That's not true. Again, that assumption is that you can convert folic acid into folate. If it says folic acid on the bottle anywhere, I would just get rid of it and find the ones that actually say folate, not folic acid. The other one I talked about before is B12. Now, there is a synthetic version of B12 called Cyanocobalamin. The cyano part of that is what it sounds like, cyanide. Cobalamin, which is the other part. Now, what I said to you before, the cyanocobalamin breaks down into cobalamin and breaks down into cyanide. Now, it's not a lot of cyanide, right? But it's a lot of products that you're taking that has cyanocobalamin. In fact, you ask most doctors, they'll probably tell you the only one that's available is the cyanocobalamin. It's not true. There are methylcobalamin that you can take, and it's a more sort of natural form, and it's actually more easily absorbed than the cyanocobalamin. There are several of them. There's hydroxycobalamin, there's methylcobalamin, but you can take those as opposed to the cyanocobalamin. And again, do not assume that that's good for you because it's, quote, given to you by your provider. Again, get rid of any B12 that says cyano, C-Y-A-N-O, part of that. Just get rid of it and use one of the other forms, hydroxycobalamin or methylcobalamin. Much easier, they're natural, they're organic, and your body will love you for doing that. Again, a lot of folks will just take what their providers are giving them and not really do any research on that. So just a little bit of caution again to you is just look at that bottle, look at the thing. If it says cyanocobalamin or cyano on that bottle anywhere, get rid of it, toss it, and you'll be better for it. The other one I talked about is table salt. I said before, and I never understood why anyone would do this. Natural salt, sea salt, has 8234 minerals in that molecule. Now, you're told that the government have removed all of these trace minerals, elements in this mineral, because it's, quote, there is no good data that says it's helpful in any way to you. Then why remove it? If it doesn't help you, if it has calcium, it has potassium, it has sodium, it has just a list of things that we have to consume, or typically would have to consume, for it to be healthy for us. But they're saying that because it's just a trace amount in it, somehow it's not good for you. So what they've done is they've removed all of those 82, 3 of them, and they've added iodine. Now, iodine is important for us because it helps to create thyroid hormone. Correct. If you have none of it or little of it, then you tend to have thyroid disorder, thyroid problems, Gorders to include, Gorders. So back in the 1920s, after they've removed all 82 minerals, elements from the thing, they added back the iodine to it because people were having issues with thyroid issues and Gorders and whatever else. They added that one thing back to it. So they've stripped the whole thing, taken all 82 plus of them away from it, left you with just sodium, and added iodine. So sodium iodine is kind of what you're taking. Now again, if the trace minerals are in there, if they're not necessarily helpful, then why remove them? But they remove them anyway. But in doing so, though, they, quote, found that the salt in and of itself, the salt that's added with some iodine in it, it tends to clump like some of the other salts will do. So what they've done is they've, quote, added a thing called an anti-caking agent to that. What an anti-caking agent really is again, more cyanide. Ferric cyanide, again, added to your table salt to, quote, make it not clump as much and has that white look to it. And I'm assuming people, quote, like that look. But again, it's a little bit more of cyanide in there. So every time you go out to a restaurant on table salt, or in your home, many of us, you have that table salt, and that table salt has an anti-caking agent in there, again, that has cyanide, right? So we talked about one before, and here's another one. Another thing that has a little bit of cyanide in there. So long-term, what is that long-term drop or droplet of cyanide doing for us long-term, synthetic cyanide specifically? What is it doing for us, right? They'll tell you that's actually good for you, but I have trust issues when it comes to that. So get rid of table salt. You can use either Celtic, and I prefer Celtic salt over organic pink Himalayan salt. And again, it's just a preference that I have. So just get rid of the table salt. It'll take you a little while to adjust in terms of how to season your food. In terms of you using Celtic salt and the Himalayan salt, it'll take you a little while to get used to it. But table salt is not what you need to do. You need to try one of these other salt. Again, put those trace elements back in your system, back in your body, and I think you'll be better for it long term. The next one I want to talk about is water. I've been telling folks to drink lots and lots of water. Typically, I tell you to drink 8 glasses of water per day, and which is a wonderful thing. And I just want to be careful. You need to be careful a little bit with that. You can tend to drink too much water, just water by itself, because you're then diluting your system, if you will, if you drink just regular water by itself. So when you go to the hospital, for example, and you're not doing well, and you're getting some saline in your system, it's not just water that they're actually putting in; they're putting in sodium chloride. So my caution to you is that when you're having your, if you're doing one big thing of water, and you're doing that, add a little granule of Celtic salt or Himalayan salt, again, just to mineralize that water just a little bit, so you're not depleting your system or not diluting your system too much. Add a little bit of that Celtic salt and that CLTIC salt or Himalayan salt. Add one little granule to it, and drink that water. You will not taste anything any different, but it'll give you your minerals back into your system that when you're adding that water to it. And the last thing I want to talk about is, I call this really the basic element of health. It's the basic things you can do to help your body do what it needs to do. Almost every cell of your body has a vitamin D receptor and have a magnesium receptor. And I mentioned before, if you were following me or you were my patient, you would have to tell me exactly why, or your doctor would have to tell me why you're not taking these three things. And I talk about a combination of things. So they're D3, K2, and magnesium. D3, now, ideally, if you can get outside between 10 a.m. and 3 p.m. when the sun is high and most intense, and you can have most of your body exposed to the sun for 15-20 minutes, you'll get about 20,000 units of D3, which is a lot, right? But many of us, most of us, don't have that luxury. I'm in a building for the most part, most of my day, and I see the sun maybe in the morning when I'm driving to work, and I see the sun maybe as I'm driving home from work. But towards the end of the day, it gets dark, right? And at the beginning of the day, it's kind of dark. So I'm not getting a lot of sun, not a lot of vitamin D. And if you live in one of those countries where the sun is down for most of the time, like I lived in Alaska for a little while, and there's times in the year where the sun might be up maybe 3 hours in the day or 2 hours in the day, thereabouts. So you're not getting a lot of vitamin D from the sun from that standpoint. So I mentioned to folks that D3 is a great way of getting your levels back up. Now, before you start D3, I would suggest as well, and you'll be surprised, get your vitamin D levels checked, right? Now, ideally, I think the government tells you that it should be normal is like 20 to 25 nanograms per milliliter. Now, that's in my opinion, that's way low. That is way low. There's lots of studies out there that tell you that if your levels are above 90 to 100, there are protective functions of D3 on your body. For example, D3 levels greater than 90, 93 I think was the number. Don't quote me on this, I think it was UCSD that did the study probably 10 years ago, that there is a risk reduction for breast cancer at that level. So what I'm being told now is that your level at 30 is normal, but you can get protection from cancer at 93. So I don't need protection from cancer. Is that what makes sense to folks? That makes no sense to me. So I would suggest getting your levels up 90 to 100 or 80 to 100 thereabouts, just to get some of those additional benefits from D3. So again, basic things. Get your levels checked to begin with, and you can, if you're, many of you, when you check your levels, you'll find that you're actually low. You're probably down to that 30, 35 range. And again, that's just nothing. Get your levels up to about 80 to 100, and I prefer for it to be 90 to 100, where you get all those protection with D3. Now, again, D3 pulls calcium from the gut and puts it into your blood, and it'll stay in the blood. It'll just stay in the blood unless it's being directed by K2. K2 is that vitamin that helps to direct the calcium from your blood, puts it into your bone, and from the soft tissue, put it into your bone. We actually need it. So one way of sort of helping to protect yourself against things like osteoporosis and osteopenia is to do exactly what I'm talking about here. Is to increase your calcium food, natural calcium foods, increase your D3 levels to where it's 90 to 100, add K2. So, and I'll put a link in the bottom of this video that'll tell you that if you're going to try the supplementation to begin with, and if you've not had D3 before, and your levels are down in the pits by 2025, then you may want to start at 10,000 units, 10,000 units by mouth in the morning, and take it with a little bit of fatty kind of food. So avocado, pistachio, some eggs, some olive oil, MCT oil, any of those things. You can take a little bit of fat with your D3. And again, D3, and the next one is K2. So if you're taking 10,000 units of D3, you may want to take 200 micrograms of K2. If you're taking 5,000 units of D3, you'll take 100 micrograms of K2. So it's typically 10 to 1 and 10 to 2 and 5 to 1 is that ratio. Then the other one to add to that would be magnesium. Magnesium you're going to take at night. Take magnesium at night because it helps you with relaxation and calmness and help you fall asleep and so forth. I like glycinate and I like threonate. Now, some people, and again, I tell you this because it happens. It's probably the most common magnesium that folks will use, magnesium glycinate. And it's typically about 400 milligrams for adult male and 350 for adult female. I take between 400 and 600 of magnesium daily. I take threonate in the morning, actually, and I take glycinate at night. There are few people out there, very few people out there, that if you take too much glycinate at night, it can do just the reverse of what it should do in terms of making you relaxed and so forth. It'll actually give you sort of restless leg syndrome where your legs sort of moving all night. So if it does that, obviously, then try another type of the magnesium. Threonate, they say that, again, I've not had this issue, but threonate helps you sort of focus and think and concentrate. So there's some issue or some concerns that threonate at night can actually keep you awake. D3, I do not take D3 again at night because, again, it's the sunshine vitamin and it energizes you a little bit, can. So I would not take that at night. I take D3K2 in the morning. I take my magnesium at night to help me sleep. And again, if the glycinate doesn't work for you, then try one of the other ones. Mag sulfate's good, citrate's good, can give you some GI issues. Obviously, threonate's a wonderful one to take. So the combination for that last bit is D3, K2, and magnesium. And again, if you've not had your levels, if you've had your levels checked and you're down in the pits, you can try the 10,000 units of D3 in the morning and 200 micrograms of K2. But if your levels are sort of up there in terms of 60, thereby you may want to go on to 5,000 units of D3 and 100 micrograms of K2. Try that sort of ratio and get your levels checked in probably 6 to 8 weeks and kind of see where those are. Many people that I know, once the levels are up by 60, if you're taking about 5,000 units of D3 and 100 of K2, then that can get your levels up to where you need to get to. Now, if you're doing this number and you get it checked again in a couple of months and your levels is 105 or 110, just cut back, right? Just maybe skip it for a couple of days and then start back. And you may want to then go down to, 3,000 or 2,000 units of D3 and get your levels checked again. But again, the sweet spot is to get that level up between 80 and 100, and ideally, in my mind, 90 to 100 nanograms per milliliter, and that should do the trick. So anyway, that is all I have for you, and I hope you just listen to them and look at them a little bit and talk with your doctor, obviously, before doing any of this stuff. And if they're telling you that they're not suggesting or recommending these things, then really ask them why. Tell me why you're suggesting I should not take these things or remove these things from my diet, because there is no good, I can't find any good reason as to why these things, obviously the folic acid should not be in your diet. The B12 Cyanocobalamin should not be in your diet. And again, they're just in so many things. There's in so many things, and it's hard to get rid of them. It's in your in baby formula. It's in your food. It's in your fortified food that you're eating. If you're eating processed foods, it's in energy drinks, right? Those folic acid and B12, it's in everything, right? And they tell you that it's okay and it's good, and if there's some cyanide in it, it's a little bit of cyanide. But then again, if you think of your life and you're living for 80 to 100 years and you're taking a little bit of the cyanide, right, daily, right, what does that do to you long term? I don't know. Right now, I worry about that, and I just know we all know that synthetic cyanide can have some complications long term. So I just try to stay away from those things as best as I can, and stay on the organic, more natural things as I discussed previously. Anyway, that's all I have. Thanks for listening, Dr. Walker.